Sometimes in looking at diets and exercise, it's very difficult to hit a home run. And with a major invasive surgery like a gastric bypass surgery, that's usually the intent, is to try to hit a home run so the patient loses a massive amount of weight in one shot. Sometimes that's unrealistic, and what needs to happen is to be able to sort of get on base and just get to the next level so that there's more motivation. And it's somewhat of a cycle where if you can start having a patient just eat less, then that will motivate them to exercise more and live a healthier lifestyle. And that's what this procedure can do for patients. So research has showed that there's an appetite hormone called ghrelin, which is produced in the lining of the stomach on the left side of the stomach. By decreasing the amount of blood flow going to this part of the stomach where these cells reside, you can reduce the amount of ghrelin that's released in your bloodstream. And that, in effect, then reduces the patient's appetite. By reducing the appetite or the hunger drive, patients naturally will eat less, resulting in a more natural way to lose weight without forcing a diet or forcing an exercise regimen. The entire procedure takes 30 to 40 minutes and is done right here in our outpatient facility. The procedure is done by starting an IV either in the femoral artery in the groin or the radial artery in the wrist. We use a small catheter that we introduce into the artery. Using our X-ray cameras, we can guide that catheter directly into the artery supplying the left side of the stomach. Once in this location, we can safely inject the particles into the lining of the stomach. If you've ever heard of anybody having a GI bleed or a bleeding ulcer, we use the same exact particles to close down those blood vessels and without any complications. The ideal patient is a patient who is about 20% overweight with a body mass index or BMI between 30 to 40. Ultimately, patients who are motivated, who are going to listen to their body, are going to do well with this procedure.